All right. Good morning. We are live, bright and early. This is Dr. Sarah Merritt with Lifestream Health Center, where we are working to make pain management more manageable. What I was going to say is actually more caring and accessible, patient-centric, and evidence-based. And we are here, located in Bowie, Maryland, speaking with Dr. Brittany Panico in Arizona. And we're just glad to have you here.
Good morning. Thank you for having me.
Good morning. Dr. Brittany is an early riser today, so thanks for getting here.
Of course.
Awesome. Well, so I'm a pain management specialist. Dr. Panico is a rheumatologist, and so there's a lot of overlap in some of the things that we deal with. We both see patients with significant pain oftentimes, and rheumatologists are uniquely positioned to help diagnose and treat those certain inflammatory conditions in particular in certain ways. So we're just glad to have you here. And Dr. Panico and I were speaking, and I think that one of the things that we could talk about today is something that I hear from patients where they may feel that their body is inflamed, or they think they have some type of pain that's inflammatory. But tell us a little more about that, Dr. Panico, because I think there are some specific tests, some specific ways to know if there's a component of like measurable inflammation going on for a patient in pain. Is that right?
Yes. So in regards to pain specifically, when we as rheumatologists treat patients with pain, one of the things that we look for is, when is the pain most bothersome to the patient? So is it something that they wake up with, feeling pain that lasts more than several hours? So does it continue even though you get up and you try to stretch, or you get up and you start your day? Is the pain lingering? And it's pain in the sense that it alters maybe the way that you function. So you may be walking a little bit different if you have back pain, or if it's joint pain, then, it may be something that you can see in the form of like swelling in your fingers or your wrists or your ankles. But a lot of times when we talk about pain in the sense of pain management and pain in the sense of inflammatory pain, it's actually stiffness that we're talking about. So it's that like feeling that you're like dredging through cement, that you just can't get your body to move the way that it's supposed to be moving. So it is uncomfortable, but it's a different type of stiffness that people feel. So it's really just the inability to move your body in the way that you had moved it before this event started. And inflammatory pain, like I had mentioned, is sometimes accompanied by swelling. So sometimes we can physically see that there's a swollen joint or group of joints, and it may be red, it may be hot to the touch. But one of the things that I think our fields overlap very distinctly is in the sense of back pain. And when we think about something like ankylosing spondylitis or psoriatic arthritis that can affect the spine, and that is something that we can test for sometimes. We can do some blood work that may show higher levels of inflammation, or we can maybe do a gene marker called HLA-B27 to try to figure out if that's related to ankylosing spondylitis. But a lot of times it starts with imaging too. So we can actually use our imaging just in the form of plain x-rays. It does not have to be anything fancy, but imaging can often show that there's either fusion in areas of the spine and the neck or the back, or something called sacroiliitis, where you have inflammation in the low part of the back, more towards the tailbone area or behind the hips. So sometimes when we think about low back pain, it's actually lower than what we consider our waist or low back or lumbar spine. So those are places that we start with.
Great. So if a patient has discomfort and stiffness, then part of that workup, of course, is the x-ray, as you mentioned, and in certain inflammatory conditions are going to be specific findings. I would imagine you may look at those images yourself as well to assess for these particular findings that you're looking for. Is that right?
Yes. Yeah. So in here, every health system is a little bit different, but here in Arizona, we primarily use an outpatient imaging center. We have two major ones, and we have access to actually look at those and pull those up ourselves from the digital files. So that's the nice thing about, things being digital, is that you can really access the reports, but then you can access the images pretty much anywhere too.
Yes, and review them yourself.
Yeah.
That's great. That's great. Yeah. And so for ankylosing spondylitis, you mentioned that one. That's maybe worth mentioning a little bit. That's a condition where a patient might present with back pain. And I guess early on in the course of that disease, as with many diseases in rheumatology, right, there might be fewer findings. That's been my experience, and as a non-rheumatologist, but who treats patients who sometimes have rheumatologic conditions. That's been my experience is early on, there might not be a lot of findings in terms of radiographic or lab workup. Is that what you see also?
Yes. Yeah. Sometimes, depending on how early we start treating the patient, we might not always see the x-ray findings. And there is also another entity that is it's newer in the sense of the rheumatology language. We've always known it was there. We just are better at defining it now, but it's called non-radiographic axial spondyloarthritis. So that makes it even more confusing because we're looking for x-ray findings and there aren't any.
Yeah.
But that entity is more, again, incorporates that stiffness kind of that I talked about, the back pain, and then other findings, typically like what we call peripheral joints. So you might come in with a wrist or an elbow or a shoulder or a knee and have recurrent tendinitis or recurrent injuries to a joint where you'll have surgery and they won't necessarily find, the type of arthritis that the orthopedic is looking for when you go in for a laparoscopic procedure or something like that. So it is really challenging in the sense that we like to have imaging findings that make it easy for us to diagnose, but sometimes we don't. A lot of times too, if we don't see what we're looking for on an x-ray, so we start with an x-ray, but if we don't see what we're looking for, then we can do an MRI that may show changes in the bone marrow, in the structure part of the bone that show inflammation or edema, swelling, things like that give us clues that there's more going on under the surface that we can't necessarily see on that back film.
Yes. Yeah. And those edema changes, right, can reflect inflammation or even recent injury. I guess I've seen it when that's the issue.
Exactly.
Yeah. Very good. I'd be interested to hear a little more about another one of your areas of expertise also, that you treat a lot of patients with gout.
Yes.
Tell me a little bit about patients with gout. Gout is a common problem, and tell us more about how a person comes to know if they have gout and how it's treated.
So I do treat a lot of gout, and gout is interesting because we used to think about it, up until the last few years, we would think about it as a red, hot, swollen, very tender, big toe. Usually people will come in complaining that they have toe pain, and you can see it. It's a big red swollen joint. Well, gout is actually very much what we call a systemic inflammatory arthritis, meaning it can affect any part of the body. So it doesn't just happen in the feet or the toes. And I've actually treated patients who have gout in the spine or in the back. It can be in the hands, the wrists, the elbows. Sometimes people will have a big swollen elbow joint. And a lot of times we don't necessarily treat it in the beginning, which we're trying to shift the path to start treating it earlier in people, because we know that just because it's in one joint, it's uric acid crystals are what triggers gout. So high levels of uric acid in the body that can form crystals that irritate the joint or our immune system and cause really intense inflammation. And so that can go anywhere in the body. It can deposit under the skin, it can deposit inside the kidneys and affect your organ function. It can even lead to a higher risk of diabetes and heart disease. So there's lots of other things that go along with just the joint pain that we see with gout. So checking uric acid levels is helpful during an episode. A lot of times people will present when they're having that swollen, painful flare. But if gout is suspected, or if there's a reason that we can't necessarily figure out why a person has pain, or if we physically see that they have buildup or nodules, we call them tophi of gout, on a joint, then we can check uric acid. And then going back to x-rays in rheumatology are always our friend because they help us determine, is this something that's causing erosion or eating away at the bone? We can actually see that. And even though something can be visible on the outside, it's not always inside the joint. So we might not necessarily see it on an x-ray, but we can see soft tissue changes around that joint that give us clues. So that's helpful too.
That's great. And so really a patient might present with a painful joint other than the big toe, but the big toe is the most characteristic.
Yes.
Interesting. Well, and I'm interested in ways that we control these different inflammatory disorders. I know that that you've done some speaking and educating about anti-inflammatory diet. What does that mean to try to consume an anti-inflammatory diet, and how does it help? Or tell me more.
Yeah, so I do talk about diet a lot with my patients, and I have more information on my Facebook and YouTube pages too. We can talk about that later as well. But basically, the root or the core of what an anti-inflammatory diet is focusing on decreasing processed foods. So everything that comes in a package that's made into something else is processed, which is majority of what our food consumption is. And it's the sugar, the refined sugar and wheat and flour products that in our system, when we eat that in our body, can trigger even very subtle levels of inflammation between our GI tract and the bacteria that live in our gut. And that over time, it's not just one event, one meal. This is something that happens over the course of time, over weeks, months, years, our lifetime. And that just triggers an imbalance between good bacteria and bacteria that don't really do much for our body or help our digestion. So when we're eating a lot of sugary things or a lot of processed foods, our body doesn't really know what to do with that. It's not a pure product like a vegetable that we can break down. And so that process over time of trying to digest all those chemicals creates inflammation in our system. And that can be felt in different forms. People can feel that in the form of joint pain, where they might feel stiff or they might physically have pain in their body. It can also be felt in the form of mood changes. So there is a link between diet and things like depression and anxiety. And it can affect how our medication is absorbed. So if we're taking an oral medication, it can actually change the way our gut absorbs medication. So when we talk about anti-inflammatory diets, it's cutting out a lot, majority if we can, of that processed food and trying to eat more of a whole food, plant-based diet. So it doesn't have to be vegetarian or vegan, but we do know that red meat tends to, again, promote inflammation for some people. So less red meat, more things like lean fish, chicken, turkey, things like that are more lean meats, but also just really focusing on trying to use ingredients in their natural form. And then I talk a lot about, recipes that make them healthy, recipes from celebrity chefs and cookbooks that they've made, and just ways that we can enjoy our food, but at the same time, actually eat something that serves our body, that actually provides nutrition to our body.
Fantastic. And I mean, I think one of the challenges is just the adjustments, making adjustments to our diets. We got to get into habits and things, and certainly convenience foods are, something that I use at times. So it sounds great to eat a whole foods plant-based diet, but I think tell me more about how do you work with patients to integrate these changes into their life so that they're sustainable?
Yes. Yeah. And it is hard. It definitely is for, busy families, people trying to make decisions on the go. A lot of it just is really deciding that you want to deciding to start with one meal a week. And that's kind of how I tell my patients is just pick one meal, breakfast, lunch, or dinner. It doesn't matter which meal, and just start somewhere, start small. And, plan out your grocery shopping, plan out ways that you're going to actually prepare the food, and decide to, incorporate those things. And then once you start to learn a little bit more about grocery shopping for produce instead of, packaged items, then you can plan more than one meal, because it's hard to prepare just one thing. So you can use some leftovers from something that you have. Like if you use half an onion, you can use the other half for something else later in the week. And, if you buy a whole cauliflower and only use half, then you can use the other half for something else again that week. So really just picking a place to start. And an easy place to start is with smoothies, because that's a way that you can incorporate fruit, and you don't necessarily need to add a lot of sugar. You can use things like honey or agave if you want to sweeten it. But just a simple smoothie recipe where you combine, a couple different versions of fruit, an avocado even, and then a little squeeze of honey. And you can use things like chia seeds or flax, or incorporate some things like that. Nut butter, if you don't have a nut allergy, you can always combine things like nut butter and then almond milk, oat milk, coconut milk, and then just mix that all together, and there's your smoothie. And then if you buy the packaged frozen fruit, you can do that again another day. So just setting aside, dedicated space in your day to prepare the meal. And then if you decide, okay, this fits into my plan, then you can meal prep, where you spend a little bit extra time, preparing, chopping, things like that. And then you have that already ready for those nights that it's busy, maybe after sports or the summer, right? When we're not necessarily like wanting to make a big meal in a hot kitchen, you already have it prepared, and you can just sort of throw it together and make something. And salads are really easy too. So you can just combine, anything that you have at home into making a salad. So
having things on hand. Yeah.
Yeah.
Those are some great actionable ideas. And I think you're right about smoothies in the summer. Yeah, that can definitely be on an evening that you're ready to eat a little lighter. I think that's very, very doable for a lot of people.
And also, I think one of the biggest places that I started with was just the thinking about what is a meal. So a meal does not have to be a meat, a vegetable, potato, a salad. It doesn't have to have all of these components that we think of when we go to a restaurant and that we get served, in courses. A meal could be a smoothie. Absolutely. I have a recipe on my page that's a squash, acorn squash that you season with some cinnamon, nutmeg, honey, and that can be a meal. That's completely fine to make something, out of a meal, out of something as simple as that. So even just thinking about the way that we think about food, when we think about dinner, it does not have to be all these different components to be nutritious and satisfying and, serve our body in a way that's good for us, that provides us nutrition.
Well, and I think the idea, it kind of unburdens the meal preparer also.
Yes, exactly.
It up in some way. And if the nutrition is there and it's adequately filling, I think that's another factor. A smoothie, if it involves some protein or some healthy fat, can be filling enough to be a light meal.
Absolutely.
That's great. That's a great thought. Well, thank you for that. I wanted to revisit a little bit. We talked about anti-inflammatory diet and how to make that work. Do you have patient anecdotes, or can you tell me about times that patients have made changes in their diet that really had benefit for their health that you were able to see as their doctor?
Absolutely. Yeah. So I have patients who, a lot of times when we're talking about arthritis, people come overweight and, not eating the healthiest. And so a lot of times we talk about weight loss in my clinic with my patients, but it's not just about weight loss. So this type of eating does, in a sense, or can help you lose weight, but it's not about that. The purpose of it is not for weight loss specifically. But I do have patients who have, changed, again, started slow and then slowly changed their diets and have, both in a sense lost weight, lost that sense of, puffiness or heaviness and bloating. And that then translates into how they feel, ultimately feel better, less pain, less stiffness. And I think one of the ways that it really stands out is with knee pain. So the biggest impact is when we have, patients with arthritis in the knees. Even just 2 to 5 pounds of weight loss can really make a big impact on how your knees feel. One of the other areas that I see it a lot is with psoriatic arthritis or psoriasis. So psoriasis is, a scaly rash on the skin that generally we can see. And part of the treatment, of course, is medication. So we use biologics and rheumatologic medications to help treat that. But it's actually very responsive to diet changes in a lot of people. And there's a big movement to understand the impact that the gut has on psoriatic arthritis as a systemic condition. So by taking away a lot of that refined sugar and things like that, patients can not only their skin gets clear, but they also feel so much better because their gut becomes healthier. And that is all in a feedback loop with their arthritis syndrome. So food is not necessarily a cure for the arthritis. It doesn't replace what medications do, but it really does help. It really does enhance the effects of medication. And it's good for our mood too. I don't know, personal experience when I'm eating a lot of sugar or drinking a lot of, sugary coffee beverages and having a lot of refined things in my diet, I'm not as, I don't think as clearly. I'm more tired. I don't wake up feeling as refreshed. And so I think we take for granted the effect that food has on our mood. And there's a reason that we reach for the sugar. It increases our dopamine in our brain very quickly. And so it gives us that reward feeling. But then we have that crash where it comes down and then we're sluggish and tired and we go grab more to get that same response again. So if we find pleasure in other things like nature, in satisfaction that we get from human interaction, from other things, then we're not necessarily looking for food to replace that. And that's a big impact when we think about autoimmune conditions and pain. How are we coping with the feelings that we're trying to manage, the emotions that we're trying to manage? So I think, having more of an even level diet where we're not getting those sugar spikes, those dopamine spikes, really does make a big difference in how we feel overall too.
Yeah, I think that's so important. And you're right. Like it's like a short-term fix that doesn't get us where we want to be to grab that sugary snack. Certainly I'm a believer in everything in moderation could be part of a healthy diet, but we have to watch some of those types of behaviors, because in some ways it's a coping strategy that's really not helpful.
Right. And we think it is in the moment and not really realizing how it affects us, even 10 minutes later.
Yeah, even 10 minutes later. And the up and the down, that can be that fast.
Yes. Yeah.
Yeah, no, thank you for that. I think that's always a great reminder too. For sure. And anti-inflammatory eating, I think, can be just so helpful for health maintenance in general with whatever conditions. I think it's so interesting too, on the one hand, hey, healthy diet, let's, eat better, let's feel better. But that there is this relationship with our gut, our GI system, that it really just regulates everything, including our brains and how we feel. This is like such a new area of discovery that hopefully patients can start to internalize and bring into their own eating and practice.
Yeah, exactly. And it's nice in the sense that it's something that we have control over. So a lot of times when you have pain or when you have a chronic condition and you feel that you don't necessarily have a say in that, right? It's something that has happened to
Yes.
you. And, even if it's an injury from an accident, right? It may not have been, you have zero control over that.
You didn't have
But when we think about what we put in our body, we have that control, and regaining that sense of control is really powerful. And also regaining the sense that, especially with food, once we try something like an anti-inflammatory diet, even again, it does not have to be every single meal. But once you start and you realize, I do start to feel better with this, it's really empowering, because it's that sense of, okay, I'm making really good decisions for myself, even though the rest of the world is happening, around me. And I think that's really empowering for people, especially when we're looking for alternative modalities to treat things, right? A lot of my patients don't necessarily want a lot of medication to treat their condition. So one place to start without necessarily using medication is to start by what we put in our body, with our food. And it does make a big impact. And a lot of times it's faster than medication. So
Interesting.
we can see changes in the way that we feel in as little as 2 weeks. And a lot of medications take, potentially months to start taking effect or feel, especially in the autoimmune world. So, food, by changing your food, that actually happens really quickly. So that's exciting too, because it's something that we can try, and it does not have to be expensive. It's not something that you have to go out and buy hundreds of dollars of supplements for. Just starting with what you have on hand, and again, kind of planning and assessing what you want to buy for a period of time. And then, just trying it and seeing how you feel. And that can happen pretty quickly.
Yeah, I think that's amazing. I think, and I agree. I do see patients that are ready to make a change for better health. And there's nothing like having a diagnosis and an incentive to say, reduce or avoid medication, to sometimes get people to be open to trying different treatments, including, dietary treatments. That's exciting. Well, good. Well, thank you so much for joining us, Dr. Panico. Is there anything else that you have that you'd like to leave us with? I'd love to hear a little bit about your practice, where you're located, and anything else that you want to leave us with.
Yes. So I am the chief of rheumatology at Summit Rheumatology in Gilbert, Arizona, but I do telemedicine across the whole state of Arizona. So I see patients from everywhere. And I've just recently started my own private practice. So I was in academic medicine for a few years and came from Chicago even before that. So I'm in private practice, and you can find us at summitrheumatology.com. And then the Facebook and YouTube that I was mentioning, I have my anti-inflammatory videos. So I do a weekly series called Eat Well, Feel Well, and highlight anti-inflammatory recipes and nutritious foods that are easy to prepare. I talk about modifications. I talk about how to fit it into a busy lifestyle. So, a busy mom of 3, I can do it. So I tell my patients, if I can make it happen, then I know you can change one meal a week. So
That's
you
great.
can find those at Dr. Brittany Panico on Facebook. So my name, Dr. Brittany Panico, and then AZ, like Arizona AZ Rheum, RHEUM Doc on YouTube and Instagram.
Awesome. Thank you so much for joining us. I appreciate you so much, and we will look forward to having you again to chat again soon.
Thank you. Yes, thank you as well.
Have a great day, everybody. All right.
You too.